afternoon, Namibia and the world, and welcome to our Wednesday edition here at the Government Information Center. My name is Desire Kahiha, and I am your host for the afternoon. Today, we are looking at the World AIDS 2022 commemorations that will be taking place. As we do know, it is that time of year that we are reminded that AIDS has not gone anywhere. Yes, it is not as bad, if I'm to use that word, but it is very much still killing our people. It is still affecting people because we are not prioritizing, informing ourselves, educating ourselves, because these numbers can be reversed. And in the studio this afternoon, I have two panelists that will be discussing this topic with us. We do have Dr. Asahit Taseo Magistu. Good afternoon, sir.
Good afternoon, Desire.
He is a medical officer with the Operations Research and Program Monitoring under the HIV/STI subdivision at the Ministry of Health and Social Services. We also have Mr. Mao Shirode. Good afternoon, sir. Good afternoon. He is the Deputy Country Coordinator for PEPFAR. Thank you very much, gentlemen, for being in the studio with us. And I think we would like to go right into it. This year's World AIDS Day sub-theme, I believe that is the country sub-theme, is strengthening community engagement in the HIV responses in Namibia. Why did Namibia opt for this sub-theme, Doctor?
Thank you, Desire, for that question. As you earlier mentioned, there is still HIV affecting our people, sometimes disproportionately. There are some categories of our population that are highly affected by the HIV, and it could be the transmission, it could be the treatment. We see inequalities in all aspects. Like you said, we have come far in the response to HIV. We have achieved progress on the target that was set, but when we look the details in the numbers, there are people who are being affected and infected disproportionately. So one of the major strategy is to encounter this inequality is addressing the inequality. So Namibia came up with strategies that can address this inequality. One of those intervention is a differentiated, tailor-made interventions, which we call differentiated model of care. One of these differentiated care model is engaging the community. By engaging the community, by strengthening the community engagement, we will be able to address most of these inequalities in terms of prevention, care, treatment, and also the treatment outcomes that we are now seeing disproportionately in some population groups.
Okay. And as I said earlier on, it really taps into that informing and educating ourselves, especially if you look at how silent, the civic education part of things have really, died down on the way that we used to do them with regards to HIV and AIDS. And I believe, I'm not subplaying it, but I believe that COVID really also gave us a huge hit in that particular sphere where everything seemingly went quiet, as if HIV and AIDS went away, because now COVID, came up. So I think it's one of those things where this theme speaks to us reigniting that fire, to strengthen, that community engagement that helps us to work together, I believe. That is my take on the theme, and it's a strong theme. honestly. And here, Doctor, I would like to stay with you again on how does this particular sub-theme complement the 2022 global theme?
Okay, thank you. The global theme is equalize, meaning to equalize that they're disproportionately affecting people that have been affected by HIV. And our team, by engaging the public, who will be able to address the inequalities. So it is like an intervention that we will be able to achieve the equalizing.
Yeah, yeah.
So when we say equalizing, what it means is that for different population group, there are different problems that will lead into this different difference in the numbers. Like for example, there are some population group that will be infected by HIV newly more than the other group. But so we will address those inequalities so that we will be able to equalize. So it is our intervention to achieve the goal that was set by UNAIDS.
Well said, well said. And as we said, it's a conversation that we have here in the studio, and in line with the theme, strengthening community engagement, we want to engage you, our audience, this afternoon, so that you can give us inputs, you can give us your comments and opinions, sometimes even advice, because we're not exactly everywhere at all times, even the officials from the various institutions. So sometimes things are happening in your community that maybe you can inform us about that would help them better their approach towards these engagements. So on our social media platforms, we are live streaming through those platforms, and you can make those comments and place your questions at these various platforms. On Facebook, you can find us at Ministry of Information and Communication Technology, Republic of Namibia. Ministry of Information and Communication Technology, Republic of Namibia. That's on Facebook. We are also on our YouTube platform, and our handle there is MICT Namibia. MICT Namibia. That is the YouTube platform. You can give us a call in the studio as well. You are very much welcome to do so. Our area code, which is the central area code, is 061. The number here is 400-397. 400-397. While we wait for you to join us, I would like to engage Mr. Shirode, and at this point we want to find out what are the factors that are contributing to inequalities that are undermining the HIV and AIDS response in Namibia.
Well, I think the major, across the public health systems, and particularly in HIV/AIDS, the major issues that lead to inequalities relate around access and availability of services and the quality of services as well. So those are the major ones. And as Dr. Mengistu said, in HIV/AIDS, we look at sort of different populations. Because every population, and population can be, let's say, men or women, or adolescent girls and young women, or more particularly what we call key or priority populations, where maybe incidences are higher, such as among female sex workers, or truck drivers, or men having sex with men, or transgender individuals. So we look at those different populations. Because of stigma and other issues, some of them might be hesitant, for example, to access services freely through public health facility. So we need to find them where they are, so to say. And it's the same thing, let's say, for some rural communities where it might be a bit more difficult for them to access health facilities. So to move us towards epidemic control or controlling the epidemic that's HIV/AIDS, we have to often find the people where they are. Whether if you are in rural communities, we have to, as Dr. Mengistu said, have differentiated service delivery modes. We can't just depend on people coming to the facilities, but we have to find them where they are and provide services in a way that's accessible to them. So I think that's sort of really what underpins, I think, a lot of the inequalities are centered around how people access services, and often the quality of services that they receive as well.
We now move to some of the measures, because as we said, this year's global theme is equalize. And this is basically a call to each and every single one of us to do what we can, you know, at an individual space and beyond, if you can, on addressing the inequalities which are holding back progress when it comes to ending HIV and AIDS. Now, I would like to find out from you, Mr. Shirode, what are some of the practical measures that are in place that have proven to be effective to ensure that we can equalize?
Okay, first of all, I guess there's what we call, a clinical cascade that includes somebody or case finding, somebody knowing their status. And that requires personal responsibility, knowing your lifestyle, your sexual history, and taking an interest to protect yourself and others in getting tested and knowing your status. So that's a personal decision that's across the board. The second one is if you are tested and you find that you're HIV positive, is to get on treatment. Namibia has what we call a test and treat policy, where as soon as you are tested positive, you are eligible to, and you can be enrolled into treatment right away without having to wait for any other additional test or anything else. So that's one part of it, to be responsible for essentially being able to take your medication or get yourself on treatment. The third one is, once you're on treatment, is to make sure that you faithfully take your medication so that your viral load can be reduced. We have, I think, a saying as well in the sector that U equals to U, which is if the virus is undetected in your system, you are unable to transmit it, or it's untransmittable. So again, that's a personal responsibility. And I think part of it loops into what Dr. Mengistu was saying about the community element, because often you, either through your peers or the community that you're part of, or fellow HIV positive people, you can band together and through this, in the community, often community adherence groups, and encourage each other to keep taking your medications. If you have issues, either you have nutritional issues, often these groups can come together and have strategies for food security, other community gardens or other strategies that they work out. Sometimes some of them have savings and loan schemes that their members can participate in and help them you know, address certain issues that are barriers to them taking their medication, whether it's food or it's other issues. So those are, I think, some of the strategies, or some of, you know, throughout the cascade, some of the issues that you can deal with.
Okay, thank you very much, Mr. Shirode. I believe that speaks to us really strengthening those points. I think that can be one of our starting points. And also as we go, we can most likely discover other forms of measures that, you know, we can add on as we figure out, as you said earlier on, you spoke about it, there are various populations that we look into. These are some of the measures that are currently in place. But hopefully as we move on with our engagements, as I said also, we learn from the various populations. As you said, you've also come to learn that sometimes it's better to meet them where they are. And it was part of the learning process. And this came about through engagement. So I'm really tapping into the theme here. I'm really, you know, connecting every single point that we're discussing to this particular theme, which then connects to the bigger theme. And as we all know, there are always activities that the Ministry of Health, along with their stakeholders, are engaged in. Activities to commemorate the day, but also just to bring awareness within the various communities to HIV and AIDS. And this is where we would like to then find out from Dr. This year's commemoration is one of a bit of a twist. We're doing things in a hybrid form. That's, if my understanding is correct. So maybe you can also just highlight to us, what are these activities? And when we're talking about them being done in a hybrid form, What are we referring to, and where are the main commemorations going to take place?
Okay, thank you very much. So the commemoration is going to take place in Oshana region, and it is going to be tomorrow, the 1st of December 2022. And the program starts as early as 8 o'clock. There will be a march from Okapana to Ondangwa service station.
Okay.
And that will be up to 10.
Okay.
So by 10, the public will arrive at the main place where the event is going to take place.
Okay.
Then, after the arrival, as usual, we'll start by the national anthem and the AU anthem, and then there will be opening prayer by the Reverend, and then there will be welcoming remark by Honorable Leonard Nangonga, who is the regional councillor on Danga urban constituency. That will be followed by a testimony by HIV activist, Mr. Jeremiah will address the public for briefly, and then on behalf of the traditional authority, Tate Shuamba Nangolo will also make a remark. And then there will be a performance by a cultural group that will be followed by Mr. Sandy Sharonda, who is the executive director of the NANASO. He will give his remark on behalf of the civil society organizations.
Okay.
Yeah, so then that will be followed by a drama by support group. And then there would be a remark by USAID country director, who is Dr. Alti Zoandor, on behalf of UN in Namibia. Then there will be a remark again by U.S. Charge d'Affaires to Namibia, Miss Jessica Long.
Okay.
And then again there will be a performance by brass band.
Okay.
And then the Honorable Elia Irmari, who is a governor of Oshana, will make a remark and introduction of the keynote address speaker. So the keynote address speaker is Honorable Dr. Kalumbi Shangula, Minister of Health and Social Services. And then that will be followed by vote of thanks by His Worship Mr. Awele, Mayor of the Ondanga town. And then again with AU anthem and the national anthem, the function will end there.
Okay.
This whole process will be directed by Director of Ceremony, who is the Executive Director of Ministry of Health and Social Services, Mr. Beknangumbe. So there are a mix of events happening tomorrow. There will be information, high-level information that will be shared in the speech by different stakeholders, but at the same time there will be entertainment and ways of getting the message across to the public.
Okay, okay. Will these activities be broadcasted anywhere?
Yes. So the reason that we are saying hybrid, during COVID, we were not be able to do in-person gathering like this one, but this time there will be in-person gathering in the place that I mentioned, and then the whole thing will be broadcasted by the local FM radio, Kati FM, the national radio, and NBC.
Okay.
So that will be another way of getting the message across the whole nation.
Yeah, yeah. So there you have it. You do not need to miss out. Just because these activities are taking place in the northern region, you as a Namibian can actually also be part of these activities. As Doctor said, they will be broadcasted. I think that is the upside to what we went through. As sad and bad as it was, 2020 taught us that there are many ways that we can try and get information across. And we evolved. We evolved, and we are using these mechanisms to try and tackle other issues in our societies as well. And speaking of that, you are welcome to please give us your comments and opinions, and even questions if you have any. You can find us on our Facebook platform. The handle there is Ministry of Information and Communication Technology, Republic of Namibia. That is on Facebook. We are also on our YouTube platform, and MICT Namibia is the handle there. MICT Namibia on YouTube. You can give us a call. 061 is the area code. The number is 400-397. 400-397. Mr. Shirode, we would like to find out then what area in HIV service delivery requires improvement from your observation, from your experiences, because we need to realize this goal of equalizing. And to do so, we really need to start looking into what can we improve, what can we strengthen, what loopholes can we close. So how do we do so from your observation? What do we need to improve so that, you know, we can do this equalizing thing in Namibia and eliminate the HIV and AIDS by 2030?
Yeah, if you look at the UNAIDS fast-track targets that Dr. Mengistu referred to, being the number of people who know their status, and the number or percentage who are on treatment, and then of those, the percentage that are virally suppressed. Namibia does well in the middle, getting people on treatment once they know their status, and relatively okay in terms of getting them virally suppressed. But we struggle mightily in, we have still a gap in terms of people who know their status. And I think, and especially among men, especially among young men, because men generally are not, don't always exhibit health-seeking behavior. Whereas women, they have other reasons to go to the clinic, whether it's antenatal services or other services, they generally do. But the man, pretty much you have to chop off his hand or something for them to actually go to the clinic. Yeah. So in that area, I think is where we have a gap and that we need to address. And I think the ministry has different strategies. One of it, because you mentioned a bit about, I think, information and having to share information. I think one of the challenges is we've had a bit of HIV fatigue over the years. I mean, people have forgotten just how bad things were in the 90s and early 2000s. And so everybody feels like they know what HIV is about or what the issues are about. And because of that, you don't often have people who are aware enough that they are at risk and that they are engaging in sexually risky behavior for them to go testing. So I think what the ministry have, one of their strategies is index partner testing, to try to target the partners of those who have tested positive for HIV/AIDS and offer them voluntary testing, and also the family members, especially children, of those who have tested positive. So that's one strategy. Another strategy for those who perhaps are reluctant to come to facility is self-testing. The ministry has self-testing kits through different, especially community implementation partners, civil society organization, community groups, that they offer, where you can get tested through the self-test kits. And if you're positive, you can then, there's a line you can dial to get counseling and to come for a confirmatory test or to have a confirmatory test done. So those are some of the strategies, testing or people knowing their status is a big, because without people knowing their status, they can continue spreading HIV/AIDS, and we won't get the incidences going down. And without the incidences going down, we'll never get HIV/AIDS under control, or we'll never get epidemic control. So I think testing is one of the challenges, people knowing their status. The ministry has some strategy, I believe, that hopefully will get us there.
Okay, okay. We spoke about some index. You said it's index?
Yeah, index partner testing.
Index
So, yeah.
partner testing.
Yeah.
Okay. And now I'm just thinking to myself, giving this information early can help either prevent it completely or also educate for those who have. A few weeks ago, we had a group of panelists here that were looking at HIV and AIDS amongst teenagers, what they go through and so on. They really had very good points to bring across, and that is also where we learned about the U equals U, and how they were having activities around the country with regards to dramatization. And I believe they will also be part of the activities in the north, if my memory serves me right. Now I'm just thinking to myself, has there been consideration made in creating these platforms, whether it's information sharing or testing or counseling or whatever, within our school environment? At the very least, let's say at high school level. Because to be very honest, society has evolved, and our kids are unfortunately having to be introduced to some of these things at too much of an early stage. Have we considered that, maybe as stakeholders? Is it something that you're working on?
Yeah, I think HIV/AIDS requires a multi-sectoral approach, and because of that, I think one of the things Namibia has done is it's not just the public health issue alone, especially in terms of prevention, because you have to get the message there earlier. A lot of young people, they have an earlier sexual debut, whereas before maybe you might have waited till 18, whatever. We're seeing, I mean, you've probably heard in sort of a different context, teenage pregnancies from as young as 13 and 14. So we're seeing a lot of young people that have earlier sexual debut. And because of that, I think the government has this multi-sectoral approach to prevention especially. And through the Ministry of Education and the Ministry of Youth, for example, the Ministry of Education through their life skills programs have 2 programs that are HIV specific. One is My Future, My Choice and Windows of Hope, which is a curriculum that tries to inform young people about the risks related to HIV/AIDS and how they can protect themselves and so on. So, and again, you can have the information about the risk of HIV/AIDS and sexually risky behavior, but we all, there's structural issues, there's structural inequalities in this world, especially in Namibia. There's income inequality, one of the countries with the highest income inequality. And there's also structural inequalities that relate to gender. So in terms of the power that a woman might have to negotiate safe sex, especially a young woman or adolescent girl or a young woman, there's power dynamics there. And they might end up engaging in transactional sex or other because of, those structural inequalities. And so we have to also address those. So those are economic issues that you have to address. So that's why I'm saying it's a multi-sectoral approach. You have to, by finding the person where they are, it's not just providing them services, but also looking at their context, their economic situation, their social situation, and seeing how you can address it, because only then can you overcome the issues that they might have or that might lead them to engaging in sexually risky behavior.
Okay. No, we hear you, and it's very true what you're saying, that you can come up with something, but first you need to sometimes deal with other issues to try and actually get to addressing the issue that you came for in the first place. And that's the sad part, actually, that dynamics play a big role. Doctor, we have a question here, and it's from one of our platforms. And the question is saying, looking at having medications that prevent fetuses from getting infected with the virus and ARVs preventing sexual partners from infections, is it safe to say we have a cure for HIV and AIDS? I think this person meant to say PrEP. I think it's what prevents sexual partners from being infected, not ARVs from my understanding. But the question states, looking at having these medications in place from infants, preventing infants from getting the virus, and from PrEP preventing sexual partners from getting infected, is it safe to say that we have a cure?
Okay, thank you. Thank you for that question. Those are the things that we need to clear for the general public, so it's a very important question. Prevention is different from cure. So the cases that our inquirer asking were prevention. So yes, there are medications that we can give to prevent mother-to-child transmission. If the mother is on antiretroviral treatment, she will not be cured, but her virus can be suppressed enough so that she won't transmit the virus to her unborn or the baby, either during labor and delivery or afterwards during breastfeeding. So again, if someone is HIV negative and if he has a risk, substantial risk, he can choose to be on medication that can prevent transmission. But again, this person is not infected, so it is not cure. So what we are doing here is preventing transmission of HIV. Cure, we are not yet there, but there are research going on. There are progresses that have been made so far. We have time where we were losing a lot of patients, but now HIV has become manageable. So as long as patients take their medication and manage to suppress their virus, they won't transmit to their partners or to their children, and they will live a productive and healthy life. So that is what we have achieved so far, but still there are researches that are going on.
Okay. We are nearing the end of our session this afternoon, but I would like to hear from our panelists just their final remarks on the matter. Dr. Shirode? Pardon me, Mr. Shirode.
I mean, it's a personal responsibility, I think, for everyone to assess the risk and take appropriate measures. I think Namibia has done really well and is one of the leading countries in terms of trying to attain epidemic control from the individual level. I think what the government or the country is able to provide is options. At the prevention level, there are various options. There's condom use, there's PrEP, there's a variety of options that are provided. And even within those options, there are various options that do female condom, male condom for PrEP. I think the ministry is looking at new innovations that are coming up, such as injectable or long-acting PrEP, which is injectable. And in terms of treatment, treatment has advanced where you used to have a lot of treatments or regimens or pills that had a lot of side effects. Now we have, treatment has advanced to where you can take less pills with fewer side effects. So those again are options. And then we also have options in terms of monitoring how you are doing through these community interventions or differentiated service delivery mode where you can be supported in your journey. And again, HIV/AIDS is not a death sentence. It's manageable, as Dr. Mengistu said, but it takes individual responsibility and community support.
Okay. Before I move on to Doctor, we do have a caller on the line, and that is Mr. Anytime from Tsumeb. Good afternoon, sir. How are you?
I'm good, and how are you, madam?
We are well. How would you like to contribute this afternoon?
Just a question, or two questions, so to say, that I want to pose.
Mm-hmm.
Yeah, I want just a distinction from the doctor. Some people associate the condition of someone with diabetes to the one with the suffering from HIV and AIDS. Maybe the doctor can make a distinction between those. Diabetes, the condition of someone who is critically going the diabetes illness to that one of HIV and AIDS. Because people, they think someone who is suffering from diabetes is just like someone having AIDS.
Oh, okay.
Yes.
Okay.
Now, the other one is this. Can one really be with HIV even like for 2 years, but when the person goes for tests, comes out negative? Like for instance, no matter what the person goes for HIV tests, and then the results are negative, but some people say that no, it's just within the blood. It can just be negative while the person is HIV positive. Is that true?
Okay. I
All right, thank you.
I have you. Thank you very much, Anytime. We shall pose these questions to the panelists.
Oh, you're welcome.
So 2 questions there, mainly speaking to diabetes versus AIDS, or HIV and AIDS. He just needs clarity given there, or just maybe educating others out there, because he spoke about people always referring to, or most people referring to, somebody who's got diabetes as a similar scenario to somebody who's got HIV and AIDS. The second question basically speaks to, can somebody test positive and then after 2 years when they go back, they test negative? So I don't know who wants to take which question.
Okay.
Yeah.
It's in terms of
Okay.
comorbidities. Or
Okay.
Yeah. Thank you for the question. HIV and diabetes, they have similarity by being chronic nowadays, but they are totally different things. HIV is infection, viral infection. That infection will attack our defense system, our body defense system, and it will lead into weakening of our immunity to fight with diseases. And that will lead to different opportunistic infection and other illnesses, including cancer. So that is why we are also doing cervical cancer screening and other medical services for HIV patients. Diabetes is a hormonal disease.
Okay.
Our body has hormones, these chemicals that manage the sugar in our body. So when our body becomes resistant to our hormone, or we are not producing enough hormone, then we will not be able to process the sugar. It may lead to some kind of weakening of our immunity, but it is not like HIV. There are other conditions that can lead into weakening of the body defense system, and but they are not HIV. So that is one way that we make them, we see them like they are both chronic disease. That is manageable with medicine, but they are totally different conditions.
Yeah.
The other question
Well, it's basically speaking to the testing at one point, and then after an extensive period of time, the person tests negative.
Yeah, so one can test for HIV negative and he or she may be in something that we call window period. So if someone gets infected today, he may not test positive today.
Okay.
His body has to react to the virus and produce the antibody, and that should be detected in our blood to say someone is positive. So there is something that we call a window period. Otherwise, that person is positive. So that is why we are very careful when we are doing this HIV test, and when we are also putting patient on treatment.
Okay. And when you have somebody testing positive, let's say this year, and after 2 years they come back and they test negative, what is that possible? What is the cause of that?
So that is a reverse now.
Yes.
When someone tests positive and you do the test again, and if he tests negative, it could be that there was some technical problems in the testing. So if you see the way we test patients, we don't test once, we do double testing, and we have to confirm the test that those who have tested positive, we do confirmatory test. So that is why. So the tests have limitation. They are not 100%, and we know that. That is why the protocol is also we need to do confirmatory testing before we put patients on treatment.
Okay, but can consistency in taking medication also cause that so-called negative test result?
There are some people who tested negative while they were on treatment, but we are not sure if they converted negative or the first test was having a problem. Or
Okay.
so we cannot say they get cured. Sometimes we test them, they test negative and wait for some time, and when you test them, they may even have a very high viral load, and they will be, infecting their partners and transmitting the infection. So we are very careful when we are interpreting those kind of findings.
Okay, okay. Thank you very much for that, Doctor. And your closing remarks for the afternoon?
Yes, okay. So, like we said, there are people that are being affected disproportionately. They are getting infected, like you mentioned. The young ones are nowadays getting a higher new infection rate. We see men are not coming for treatment. And they are not responding for, they are not having good outcomes of their treatment. So there are population groups who are disproportionately affected and infected by the HIV, and that needs a tailored intervention. And the government has tried to come up with different model of care to address those kind of challenges. Services are available, free. There are people who are in hard-to-reach area. There are mechanisms for those, even those people who are living in hard-to-reach areas, like outreach services and other community-based services. So people should access those services, and like my colleague said, they have to the community has to lead.
Yeah.
They have to be empowered to even work on discrimination, stigma, and so on. So with those, I think if we manage to address the inequality, we will be able to end HIV as it was planned by UNAIDS.
Okay.
Thank you.
Thank you very much for that. Definitely wise words from the gentleman here in our studios that gave us a bit of light to some of the issues that we find with regards to the problem of HIV and AIDS in our country, and also some of the interventions that have been put in place and some that continue to be improved or worked on for us to try and fight and eradicate HIV and AIDS. As we said, that as much as it's manageable, it does not mean that it has been eradicated, and we need to work together through our strengthening of community engagement. Please be reminded that the activities for this year's HIV and AIDS, World HIV and AIDS Day are being commemorated in the Oshana region, and there is a march from the Okapana to the Ondangwa service station, and the program kicks off at 10 o'clock, and it is a healthy program that will be broadcasted via various platforms to ensure that everybody gets to hear and attend these commemoration activities, regardless of where they find themselves in the country. For this afternoon, we do say thank you to our panelists for being with us. Thank you very much, gentlemen.
Thank you, Desiree. Thank you very much.
And from myself, Desire Kahiha, along with my production crew, it's bye-bye till tomorrow.